Welcome to the channel. So today in this video we are going to cover some questions with their brief explanations. So here we have a first question is the normal value of bleeding time range from, and the options are option A 60 minutes, option B 15 to 30 minutes, option C 1 to 5 minutes, option D 5 to 10 minutes. So the normal value of bleeding time range is, the correct answer is 1 to 5 minutes. The normal value of bleeding time range from is 1 to 5 minutes. So let's discuss with the help of explanation that the time from the beginning of incision until the termination of bleeding is considered as the bleeding time, and a standard filter paper should be used at every 30 seconds to draw off it until the blood completely stops. So the normal bleeding time values in the range of 1 to 5 minutes. So the correct answer is 1 to 5 minutes. Moving on the next question. Which method do not increase solubility? Options are option A hydrotrophy, option B increase in particle size, option C complexation, option D co-solvency. So which method do not increase solubility? So the correct answer is increase in particle size do not increase solubility. Let's discuss with the help of explanation, students. That the method of increase the solubility are the temperature, polarity, hydrotrophy, co-solvent, or stirring increase the speed of dissolving, which increase the solubility. So this is all about this question. Moving on the next question. One of the following actions of opioid analgesic is mediated via kappa receptors. Options are option A is physical dependence, option B is euphoria, option C is spinal analgesia, option D is both A and C. So which of the following action of opioid analgesic is mediated via kappa receptor? So the correct answer is both A and C, means physical dependence and spinal analgesia are the actions of opioid analgesic which is mediated by kappa receptors. So let's discuss with the help of detail. Here we have this table that for the mu receptors, the analgesia, that is a supraspinal mu1 and spinal mu2, or sedation, euphoria, meiosis, physical dependence, and reduced GI mortality. Where for kappa receptor, analgesia, that is supraspina or spinal, sedation, meiosis, physical dependence. And for delta receptor, analgesia, supraspinal mu1 and spinal mu2, which reinforce the action and reduce GI mortality and affective behavior. So this is all about the receptors mu, kappa and delta. So this is all about this question. Moving on the next question. Which of the following hormones is a steroid? Options are option A is estrogen, option B is glucagon, option C is insulin, option D is oxytocin. So which of the following hormone is steroid? So the correct answer is that estrogen is the following hormone which is a steroid. Let's discuss it with the help of detail that steroid hormone is produced by 3 endocrine organs. First one is testis, produces testosterone, ovaries produces estrogen, and the adrenal cortex produces steroid hormones such as cortisol or aldosterone. Steroids hormone are derived from the cholesterol and are lipid soluble molecules. So estrogen is a steroid which is produces by ovaries. So next question is, Internally coded inheritable information carried by all living organisms is known as. Options are: option A is genotype, option B is phenotype, option C is metabotype, option D is pharmacogenomics. So internally coded inheritable information carried by all organisms is known as, and the correct answer is genotype. Internally coded inheritable information carried by all living organisms is known as genotype. So let's discuss in detail that genotype is internally coded inheritable information carried by all living organisms, and the whereas phenotype is the composite of an organism observable characteristics or traits such as its morphology, development, or biochemical or physiological properties, phenology, behavior, and products of behavior such as bird nest, where the metabolic variability criteria can be used separately or in assertion to provide reliable pictures on different metabolic phenotypes of a biological system, such as pictures characterizing the metabolic phenotypes are called metabotypes or chemotypes. So this is all about the genotype, phenotype, or metabolic variability. So students, try to memorize these terms with their specific characteristics or with their definition, so it will be more helpful to attempt the questions. Moving on, the next question: bubble point pressure is test is related to. Option A is laminar flow, option B is autoclaving, option C is radiation sterilization, option D is membrane filter. So bubble point pressure test is related to, and the options are: option we are having laminar, autoclaving, radiation, and membrane. So the correct answer is membrane filter. So bubble point pressure test is related to membrane filter. Let's discuss with the help of explanation that the membrane filter is made up of cellulose and its derivative, and its size is 0.2 to 0.45 micron, and forces combined or force of gravity and van der Waals forces. The students, try to note down these important information about membrane filter, because sometimes the question may also ask the what is the material or what is the size. So this is all about this the membrane filter, and the efficacy can be determined in terms of bubble point, which is the characteristics of porosity. So this is all about this question. Next question is: which among the following is a method of permanent contraception? And the options are: option A tubectomy, option B is hysterectomy, option C is tracheotomy, option D is none of the above. So which of the following is a method of permanent contraception? And the options we are having: tubectomy, hysterectomy, tracheotomy, none of the above. So the correct answer is tubectomy. Tubectomy is a method of permanent contraception. Let's discuss with the help of explanation each term, that what is hysterectomy. That it is a operation to remove a woman's uterus, removing a woman's uterus, and a woman may have a hysterectomy for different reasons, including the uterine fibroids that cause pain, bleeding, or other problems, and uterine prolapse, which is a sliding of the uterus from its normal position into the vaginal canal, and where tracheotomy or tracheostomy are, it is a surgical procedure which consists of making an incision or cut on the anterior aspect of the neck and opening a direct airway through an incision in the trachea. As its name indicate, that it is denotes from word that related to the trachea, tracheotomy or tracheostomy. So next is the resulting stoma hole can serve independently as an airway or as a site of tracheal tube or tracheostomy tube to be inserted. This tube allows a person to breathe without the use of nose and mouth. So next term is tubal ligation or tubectomy, which is the correct answer. So it is a surgical procedure for sterilization in which woman's fallopian tubes are clamped or blocked and sealed, either of which prevents egg from reaching the uterus for implantation. So which helps in contrast. So these are all about these question. Correct answer is tubectomy. So next question is find the missing number. Here we have a schematic diagram as it shows the question mark. So we have to find out the missing number. Option A is 24, option B is 19, option C is 22, option D is 20. So which is the correct answer, and what is the missing number? The missing number is 22. So let's discuss with the help of explanation that 8 into 3 minus 3 is equal to 24, minus 3 is 21, and 6 into 5 minus 5 is equal to 30 minus 5. 30 minus 5 is equal to 25, where 12 into 2 minus 2 is equal to 24 minus 2 is equal to 22. So the correct answer is 22. Next question is name the most common type of cancer that kills men in the world. Option A is lung cancer, option B is prostate cancer, option C is liver cancer, option D is colon and rectum cancer. So which is that common type of cancer that kills men in the world? So the correct answer is lung cancer is the most common type of cancer that kills men in the world. Let's discuss with the help of explanation that lung cancer is the most common type of cancer that kills men in the world. So correct answer is lung cancer. Next question is the value of stretching frequency of a bone can be calculated by. Option A is Hooke's law, option B is Stokes law, option C is Lambert's-Beer's law, option D is none. So the value of stretching frequency of a bone can be calculated by Hooke's law. So let's discuss about Hooke's law. That Hooke's law is IR, which is having stretching frequency for measuring of stretching frequency, and where Stokes law is used in sedimentation process to determine diameter. And what about Lambert's-Beer's law? It is used in UV spectroscopy for transmittance and concentration respectively. So this is all about this question. Moving on the next question. A prokinetic drug is, and the options are, option A is ondansetron, option B is dicyclomine, option C is metclopramide, option D is chlorpromazine. So which is the prokinetic drug? So the correct answer is metclopramide is a prokinetic drug. Let's discuss in detail that ondansetron is a 5-HT3 antagonist having antiemetic effect, and where dicyclomine is anticholinergic, and metclopramide is a prokinetic drug, and chlorpromazine is a neuroleptic drug. So the correct answer is metclopramide is the prokinetic drug. So this is all about this question. Moving on the next question. On which date the 2019 World Book and Copyright Day WBCD is observed recently? And the options are, option A is April 21, option B is April 22, option C is 24, option D is April 23. So on which date the 2019 World Book and Copyright Day is observed? So the correct answer or correct date is April 23. In 2019 the World Book and Copyright Day is observed. Here we have an explanation on this. That the World Book and Copyright Day is observed on April 23 to recognize the scope of books which are seen as a link between the past and futures, a bridge between cultures and generation. So the correct answer is April 23. Next question is schedule for the patent filing. Option A is U, option B is schedule V, option C is W, option D is F. So which is the schedule for patent filing? So the correct answer is schedule V. V for the patent filing, V for victory and V for patent filing. Let's discuss with the help of explanation that schedule U is particular to shown in manufacturing, raw material, analytical data and record of drug and cosmetics there, and V is student for patent filing. W is for list of drug whose import, manufacture, sale, labeling are governed by special provision, and F is for standard for surgical dressing and sterilized tapes. So this is all about the scheduled explanation. So the correct answer is schedule V is for patent filing. Now the next question is the long acting sulfonamide is, and the option A is sulfacetamide, option B is sulfadiazine, option C is sulfamethoxazole, option D is sulfadoxine. So which is the long acting sulfonamide? So the correct answer is sulfadoxine is the long acting sulfonamide. So let's discuss with the help of explanation. Here we have the complete explanation of the sulfonamide, that for short acting are sulfadiazine, sulfacetine, sulfamethoxazole or sulfoxazole, where intermediate acting is sulfamethoxazole and sulfamoxazole, and long acting is sulfadoxine and sulfamethoxyrazine, and where orally non absorbable agents are sulfasalazine and olsalazine, and the sulfonamides which is used as a topical agents are silver sulfadiazine, sulfacetamide or mefenide. So this is the classification of sulfonamide, students. You have to learn this classification. If the question may arise from these subclass, so you can attempt easily. So moving on, the next and last question of this video: which Indian personality has been conferred the UAE highest civilian honor, that is Zayed Medal? And the options are: option A is Sania Mirza, option B is Shah Rukh Khan, option C is Narendra Modi, option D is Shashi Tharoor. So which Indian personality has conferred the UAE highest civilian honor, that is Zayed Medal? And the correct answer is the Narendra Modi. The Namo has is the only Indian personality has been conferred the UAE's highest civilian honor, that is Zayed Medal. So let's discuss with the help of explanation that the UAE President Sheikh Khalifa bin Zayed Al Nahyan, it's the name of UAE President. Students, just memorize this. Conferred the prestigious Zayed Medal to the Prime Minister Narendra Modi for giving a big boost to bilateral strategic ties between the two countries. And the award comes in appreciation of PM Modi's role in consolidating the long-standing friendship and joint strategic cooperation between the two countries. So the Zayed Medal is the highest decoration awarded to kings, presidents and heads of these states. So students, the correct answer is Narendra Modi. So this is all about this video. Thanks for watching.